like crap leaves or something happens.
Hi, Mrs. Myers. My name's Jenny. I'm going to be your student nurse from the University of Detroit Mercy.
Okay.
We're going to be doing a head-to-toe assessment on you. If you excuse me, I'm going to go wash my hands, okay?
Okay.
Alright, do you have any allergies I need to be aware of?
No.
No? Are you in any pain today?
Yeah.
Okay, where is your pain located?
In my elbow.
Okay, on a scale of 0 to 10, what would you rate your pain?
A 5.
A 5. Do you need any medication at the moment before we proceed on?
I don't think so.
Okay. Is the pain a dull pain, a sharp pain?
It's a sharp pain.
Okay, does it radiate anywhere else?
Yeah, to my fingertips.
It goes to your fingertips.
Mm-hmm.
Okay, how long have you had this pain?
Since Saturday.
Did you do anything to make it hurt? Did you fall?
I was helping my brother move, and I think that I might have hurt it lifting some boxes.
Okay. All right, great. So I'm going to report that to the doctor. Does anything make it better?
I take ibuprofen for it.
Okay. Yep. So I'll report that in your chart. Okay.
Okay.
So since you said you didn't need any pain medication, we can continue on with the head-to-toe assessment, right?
Yep.
Okay. So the patient seems to be dressed appropriately. There's no obvious signs of body odor. Her speech is normal with a normal rate and volume. Can I check your wristband, please?
Yes.
Can you say your last name for me?
Myers.
And what's your birthday?
11/10/90.
Okay. And where are you right now?
I'm at the hospital.
Okay. And what's the reason as to why you're here?
For an assessment.
Okay. So the patient is alert and oriented ×4. The patient doesn't seem to have any obvious signs of distress or illness, so I can continue on with her assessment. So first I'm looking at your skull. The skull is normal cephalic. There is no obvious signs of lumps or bumps or lesions. There's no infestations in the hair. Go ahead and put your face up. The skin is warm to the touch. There is an even skin tone. There is a nevus on her right upper cheek. It is symmetric. The border is even and accommodating. There is an even color, and the diameter is less than 1 centimeter, which is less than a razor head, and it's not elevated. So I'm going to write that down for you, okay? So the skin, like I said, is even skin tone. There's no lesions. There's no drooping of the facial features. So what I'm going to have you do is I'm going to press on a couple places of your face while I have your eyes closed, and you're going to tell me where I'm pressing, okay?
Okay.
Close your eyes. Forehead.
Nose. Cheek.
Alright, great. So that is testing your cranial nerve 5 for your facial sensation. So now can you smile big for me? And puff out your cheeks. And raise your eyebrows. Okay, so cranial nerve 7 is also intact. So now I'm going to be looking into your eyes. You can stare straight ahead. Great. So your pupils are equal, they're round, and they did constrict with the light. If you can stare straight ahead of my pen as it goes towards your face. Nice. And they did converge as well as constrict. So therefore the pupils are equal, round, reactive to light, and accommodation. So now let me see your conjunctiva here. So look up for me. It is clear, glossy, there's no signs of inflammation or cyanosis. So now we're going to be looking in your mouth. Go ahead and open your mouth for me. The mucosa is nice and pink. There is no signs of lesions or any type of cavities of the teeth because they are nice and white and evenly spaced. Go ahead and stick out your tongue for me. The tongue is moist, and say ah. Ah. The uvula raises midline when you did say ah, and your tonsils are graded at about a +1 because they are present. However, they're not inflamed, so that's a good thing. So now I'm going to be looking at your carotid arteries. So I'm going to palpate this real quick. Good. Okay, both of the arteries are equal bilaterally. They're rated at a +2. So now I'm going to listen with the bell. When you feel my stethoscope, I want you to breathe in and hold it, okay? Nice. One more time. Okay, I did not hear any signs of release. Okay. So now we're going to be moving down your arms here. The temperature is even, the hair distribution is even as well. The temperature is warm. Go ahead and flip your arms over. Her brachial pulses are equal. They're not bounding. They're rated at about a +2. Move down to your radial. Those are nice and there you go. They're rated at a +2 as well. Flip your hands over. Your nails are nice and clean. The capillary refill is at less than 3 seconds. There's no clubbing of the nails. I'm going to test your strength, so if you can grab onto my hand, nice and tight, good. There is no weakness of the upper extremities. So now we're going to be listening to your heart, okay? So what we're going to do is in the second intercostal space, I'm just going to do that while I'm doing this, is her second intercostal space is the aortic, and that I should be hearing S2 sounds. Move over here to the second intercostal space is pulmonic, also S2 sounds. Third intercostal space is going to be the herbs. Fourth intercostal space is the tricuspid, which should be S1 sounds. And then the mitral sounds in the fifth intercostal space, midclavicular line, should be S1 sounds as well. I'm going to be sitting here for 60 seconds. Okay, listening to the apical heart rate. Flip it around to the bell, and we're going to be going upwards, backwards from mitral, tricuspid, herbs, pulmonic, and aortic. Great. Don't hear any abnormal S3 or S4 sounds, which is good. So now I'm going to be listening to your lungs. So every time you feel my stethoscope, if you could take a deep breath in for me, okay?
Okay.
Okay. Okay, you can start to breathe normally now. Alright, so I'm going to move to your back and do the same thing. Right up in there. Go ahead, deep breath for me. Nice, now you can breathe normally. Okay, can you raise your arm for me and take a deep breath? Alright, great. I don't hear any adventitious lung sounds, and that means your lungs are clear. So what I'm going to do is I'm going to test the tenderness down here, okay?
Okay.
Do you have anything there?
No.
What about there?
No tenderness.
Okay. So go ahead and lean forward for me. We're looking at your spine. The spine is midline. It is straight. There's no signs of scoliosis. Go ahead and sit up. Her anterior-posterior diameter is rated as 2 to 1 because 2 to 1. Alright, so now we're going to be looking at your abdomen, okay? Go ahead and lay down the pillow. It's a little crunchy. Do you need your feet out here? A little bit? Okay. So first I'm going to be inspecting the abdomen. Then I'm going to auscultate, percuss, and palpate. Okay. So it is, the abdomen is flat, the contour is flat. There is no obvious signs of lumps or bumps or abrasions. So I'm going to be listening to your bowel sounds in all 4 quadrants. Sorry, I always do that.
You're good.
Okay, bowel sounds were heard in all 4 quadrants. If not, I will listen for a little bit longer, up to 5 minutes. So now I'm going to percuss. So down here in the right lower quadrant, it's going to be a tympanic sound. Up here in the right upper is going to be dull because of the liver. As well as over here, it's going to be tympanic until you get over to the spleen, to be dull. And then also tympanic down here. Your aorta is right above the umbilicus, which it is midline, as well as your bladder is midline as well. Okay? So down here in the right lower quadrant, it's going to be the appendix and the cecum. Up in the right upper is the liver and the gallbladder. Left upper is the spleen, stomach, and the pancreas. And then the right or the left lower is the sigmoid colon. Did you have any tenderness in these areas?
No.
No? Okay, great. So I'm going to have you set. When the patient sat up, there was no signs of jugular vein distension. So that is good. Moving down to your legs here. Okay, the temperature is warm to the touch. I'm going to be feeling your popliteal pulses.
Okay.
Your pulse is rated at a 2+. It's equal bilaterally. Go down here to the feet. There's no signs of edema. The posterior tibialis is also rated at a 2+ and it's equal bilaterally, not bounding. The dorsalis pedis pulse, you can find it. It's good. It's equal bilaterally, also rated at a 2+. There is capillary refill of the toes, rated at a 3 seconds or less. And we're doing a little tickle test on you.
Okay.
Test, okay? Alright, so it is a negative Vinci test because her foot went down instead of up. Go ahead and sit or stand up for me. I'm going to have you walk to the wall. And then walk back. Go ahead and stand. And you could stand there. Go ahead and put your hands up for me. Close your eyes. And you would stand there for about 20 seconds. Do you feel dizzy at all?
No.
No? Okay, you can open your eyes. So she passed the Romberg test because she did not feel dizzy. Now, are you in any pain at all?
No.
Okay, you can go ahead and sit down, and that will complete your head to toe assessment.
Thank you.
Thank you.